Good morning, and welcome to the latest installment of Mazzetti's Bending the Climate Curve learning series. I'm Christina Vernon Sanborn, Principal and Sustainability Practice Leader here at Mazzetti, an employee-owned benefit corporation where bending the climate curve is our mission. This morning, we will explore climate action in healthcare, a sustainability director's journey. Srini Pendikatla will share his journey leading climate action in healthcare, including the impact on community health, and climate action planning through benchmarking, tips for success learned along the way, and how anyone can take action no matter where they are in their own climate journey. Srini is an associate principal and senior mechanical designer with more than 18 years of experience in system design and sustainability across healthcare, public sectors, and utilities. His work centers on leading mechanical and sustainability initiatives, delivering measurable results, and guiding teams towards low carbon operations in healthcare settings, particularly throughout the Seattle region. Before joining Mazzetti, Srini led all sustainability efforts at Seattle Children's Hospital. He authored a 10-year climate action plan with ambitious targets, including a 50% reduction in scopes 1 and 2 by 2030, a net zero vision, a 20% energy reduction goal, and a 50% waste diversion goal. He unified leaders across departments, integrating nearly 40 KPI across 9 program areas into routine operations while supporting planning for a future campus designed to achieve LEED Gold certification. Srini also led a team that developed a multi-year portfolio of emissions and energy projects, resulting in a 16% reduction in scopes 1 and 2 emissions to date. Major accomplishments included an 86% reduction in anesthesia emissions and a 25% reduction in fleet emissions. His work generated more than $1 million in cost savings and supported compliance with Washington state clean buildings requirements. Under his leadership, the hospital was recognized as one of the top 25 greenest hospitals in the United States for 2 consecutive years. Srini has served on policy committees shaping regional and national climate standards, and drawing from his time embedded in hospital operations, has served as facilities manager on call to directly support patient care environments. He brings strong technical expertise, proven leadership in program delivery, and results-driven approach to sustainability grounded in a deep understanding of healthcare operations. I know I'm excited to hear his story. So today we are going to focus on 4 learning objectives. Why this work matters, and it matters to human health. How to think about benchmarking as a tool in your toolkit. Tips from success based on experience, and how to get started regardless of where you are today and what you might have done in the past. So before we get started, a bit of housekeeping. Today's event has been submitted to the AIA for one AIA Health, Safety, and Welfare CEU. If the program is approved, we will submit your attendance. If that's important to you and you didn't provide your AIA number when registering, please send it to info@mazzetti.com and we'll get you taken care of. We will hold questions until after today's speaker has made his presentation. But you are encouraged to ask your questions at any time during the presentation via the Q&A function of the webinar. Whenever it occurs to you, that's a great time to enter it into the tool. Today's session is being recorded, and a recording will be shared along with a copy of the slides to all attendees. With that, Srini, take it away.
Yeah, thank you, Christina. Let me share my slides here. All right, can you see that? All right, so good morning, everyone. And thank you for joining me so bright and early, at least here on the West Coast. It's 8 a.m. And it's also after a long weekend. I'm here to talk about my journey with climate action in healthcare. As a former sustainability leader, I say that a little tongue-in-cheek, which I'll mention here in a minute when I get through the agenda. So I wanted to start about my background. I'll talk about that briefly. Christina had a good intro, which I didn't hear before, so thank you. And then a little bit of focus on why of climate. So there's a lot of talk about mitigation work, basically what to do, but I personally feel like there's less focus on the why. So talking about why hopefully will level set people's knowledge and reinforce the what on how to tackle the issue. I think it also can be really helpful to connect the dots for mitigation work and community health, especially as it relates to nonprofit hospitals, the community health needs assessments, the community benefits that nonprofits have to do. And depending on where you live and the appetite for these type of conversations, talking about patient health outcomes and impact from the severity of weather events, absent of what caused them, can also bolster the case for doing this work, especially when it comes to resilience, which is the ability to adapt and or recover from an event. And of course, I want to talk a little bit about mitigation as well, but it's at a high level. I should note I am no longer affiliated with any hospital or recent projects, so I'm not able to specifically talk about a particular project or the impact. So the numbers Christina mentioned are all true, but I can't necessarily speak about them in more depth than that. But I do have some generalities using some publicly available data and also we'll run through an example with energy. And then lastly, tips for success. Again, more high-level things I've noticed working that have worked for me to offer, and then brief how to take action regardless of where we are or where you are. Okay, so introduction, a little bit about me briefly, just to add to what Christina said. So I'm a licensed mechanical engineer in the state of Washington. I've joined Mazzetti back in October. So as Christina mentioned, I was the former sustainability director at Seattle Children's, and I led org-wide efforts for all aspects of sustainability. A lot of the focus was on things like energy and waste, but there's also a bit more that people see. But there was a lot of behind the scenes work with, well, emissions reductions too, but also environmentally preferred purchasing, green buildings, and some of the other things that more are integrated into processes rather than tangible things you see in day to day. And as Christina mentioned, the organization did receive Top 25 Greenest Hospital from Practice Green Health for the last 2 years in 24 and 25. And that's, I would say, a testament to the success of the organizational effort and a lot of the programs that were in place and then added and grown upon under my leadership, but also a little bit about kind of, I would say, essentially herding cats to leverage and lead different program efforts because a lot of the work was happening. It's just a matter of bringing it all together in a kind of a formable way. And while my position here at Mazzetti doesn't include the word sustainability, like I noted in the title, I say former, because you can take the person out of sustainability, but you can't really take sustainability out of the person. That's to say that once you go down this path of learning more and more about sustainability, you can't really look away. So as a result, I think I'm a better engineer today than I would be if I didn't have that experience. Okay, so why climate action in healthcare? This and the impact on climate health outcomes. So this is the climate wheel from CDC. I'm sure many people have seen it. It's a little bit harder to find these days, but was able to find it. I did used to have one that rotated, um, but anyway, so climate change directly impacts human health. A brief walkthrough here. We have increasing emissions which lead to rising temperatures, which lead to more extreme weather and rising sea levels. And it's basically a continuous loop as we continue this our business as usual case of how we do things. And we've all experienced extreme weather in recent years and months. So extreme heat up here at the roughly 10 o'clock area. 2025 was the hottest year on record, and that continues projections that from previous years. So 2024 was the hottest year, a record, and 2023 was before that. Some examples: last summer we had a heat dome in the central U.S. Towards the East Coast, where roughly half to two-thirds of the U.S. population faced record high or record heats for prolonged periods, and then the Southwest like the Phoenix area had temps break 110 for over a month straight. And it's not just the highs that are concerning, it's also the lows. The lows are higher at night, which makes it harder for human bodies to cool down and prepare for the next day's heat. So it does impact heat-related illnesses, death, and cardiovascular issues as a result. We also have extreme weather events like atmospheric rivers, which is a term that I never heard of before, maybe 5 years ago. Intense rains have happened just last month here in the Seattle area where I live. Last month, that led to a number of floods and a lot of issues that we're still dealing with in the region. There was also that story, I think it was in Texas in roughly August last year, of that summer camp with the floods that resulted in the loss of life. So really the injuries, fatalities, and then also the mental health impacts of people who do survive those events. And those atmospheric river also introduced toilet rats, part of our everyday vernacular. So it's um, a unique one. And then, of course, we have wildfires in the summer. So that leads to air pollution and increasing allergens, both at the, was that 1 o'clock and 4 o'clock here. We had, wildfires in Maui in the Lahaina neighborhood a couple of years ago. I think it was 2023 now. Then LA fires that wiped out a whole neighborhood. And that those smoke pollution really leads to increases of many impacts on human health, like asthma and cardiovascular diseases. All this to say is really that climate change impacts human health and increases the acuity of care that patients see. So while climate-caused hazards are increasing, the impact is not universal to all populations. Exposure to those hazards, sensitivity to the changes, and the ability to adapt all impact individual and community climate vulnerability. So exposure are things like how long, of course. So like an outdoor worker in extreme heat has more exposure than, say, an office worker who sits in an air-conditioned building, or a low-income person relying on public transportation for someone who is able to drive and have AC in their car. Sensitivity, how susceptible someone might be. So someone with pre-existing conditions or age, and that's to come from a pediatric hospital. Children tend to have a lot more sensitivity to these events as their bodies are not as developed, so they're more susceptible to smoke, to develop asthma and other respiratory issues. And then ability to adapt. There's resources available for some people, but not everyone. So this really comes back to the social determinants of health. Older people may, on fixed income, may not be able to access transportation, for example. So those taken together really lead to the adverse health outcomes. So another way to look at it is this graphic from the World Health Organization. So we have vulnerability over on the left, climate-caused hazards in the middle, and the exposure on the right, which all lead to worse health outcomes on the bottom of the screen. And an added twist in this graphic is the impact on health systems and facilities, which many of us here specifically work to mitigate. So extreme hot or cold, excessive water from rains, floods, wildfire smoke, they all impact infrastructure systems. So these systems at hospitals need to really be available during these worst days for communities that the hospital serves. So we must design new or retrofit existing buildings to withstand that 100-year or 300-year storm event, which seem to occur more and more almost every other year now, so that hospitals can really serve the people and their community when they are needed the most. So I really like this graphic. It's a very simple graphic I came across on the World Health Organization website, but I really think it hits the mark. So we have monitoring and measuring climate change and health progress. So roughly emissions from operations. Then we over at the top of the screen, assessing operation systems and impact community and community health. We do some internal planning with community resources and input from them. We seek some funding. Some of the bigger changes, like an all-electric hospital or central utility plant. Then we implement those interventions. So it could be big like that, or it could be smaller changes which don't necessarily have huge costs. But taken all together, that's how you build climate resilient health. So here's a kind of a more robust outlook spread across 4 focus areas. So this is from the Climate Resilient Healthcare Toolkit it was from the HHS and the OSH department, but the 4 focus areas we have clockwise starting top left is mitigation, preparedness, response, and recovery. And this takes commitment to make this happen, collaboration, coordination between so many different groups in healthcare and adjacent to healthcare as well, like public health officials, regional emergency management, and also emergency response. Because if things go down a certain way and emergency responders bring, 100, 150 people to a hospital, the hospital needs to be ready. And that's where most of us here can help, which is here on the left side of the graphic, is really having a detailed, hard look at our facilities and operations to identify risks and then address those critical infrastructure risks. And then also, of course, retrofitting is much harder than building a new facility, but really future-proof design of facilities to withstand those more extreme and longer duration weather events is how we do this. So I want to go a little bit deeper on this. So looking at community health. Uh, Looking at community health outcomes, kind of saying what you mean when you say what a zip code someone comes it from and the impact of their health and longevity of their life. So these maps are all from the Washington State Department of Health, and are roughly centered around the city of Seattle, which is where I live, which is why I do it that way. So quick orientation. This is environmental exposures, which I'll talk about in a second. But if you're not familiar with the Pacific Northwest and Seattle specifically, this is roughly Seattle. The northern limit is city limit is around here. Southern limit kind of cuts at an angle across this way. This is Puget Sound. So to the west is well, more state of Washington, but it leads out to the Pacific Ocean. Here is a giant lake, Lake Washington. It splits Seattle from the east side suburbs. We also have a man-made ship canal cut down here into Lake Union and then across here into Lake Washington. That's important as it relates. In a minute, I'll talk about that. Splitting North and South Seattle a little bit. Downtown Seattle is right here, and then the airport's like down here off the map somewhere. So this first map here shows the environmental exposures, which include things like proximity to major traffic roads, small particulate concentration, the PM 2.5, and diesel emissions, among many other things. And it's worth noting I-5, which is our the major interstate that runs through Seattle, is right here through this area and then down this way. So you can see the higher ranks are the darker colors, which are mostly down here, but also kind of mirror the highway up here as well. So next we have environmental effects. So the environmental exposure plus environmental effect equals the threat. So environmental effects are things like proximity to industrial areas, like waste treatment and processing sites, and also Superfund sites, which is an EPA declared heavy pollution area. So this whole area down here in South Seattle, or this is the Soto neighborhood. This area is zoned industrial, but there's a lot of industry down here as well. There are neighborhoods over here and over here. Um, so these two things together, like I said, is the threat, but times the next two maps, we have the socioeconomic factors like low income, limited English, and transportation expenses. And then notice for this one, a lot of this is clustered down in the South Seattle area, which is not by coincidence, because this is where, in the city's history, redlining took place. So brief history tangent. So up until the Fair Housing Act was passed in 1964, the city actually had loopholes until 1978, which they actually own on their website, which is a pretty interesting story and a rabbit hole in itself. But people of color were unable to purchase housing up in these neighborhoods in North Seattle. That's why I illustrated the ship canal cut here. And were forced to live down in this area. So redlining is the practice to enforce that through the process itself, meaning that the deed for houses had racial covenants, as did the bank loan process, zoning. So there were a lot of steps and layers that prevented certain populations from moving to quote unquote more desirable neighborhoods. And so why does this really matter 60 years later? Well, a couple of reasons. So first, generational wealth is attained through housing and real estate. So properties down in this area didn't appreciate as much as houses up here. So that leads to the generational wealth aspect of it. The other thing is later on, more in the through the 80s, 90s, 2000s, people who moved to the city would some of the that history shapes the city like it does every city in the U.S. where people moving here today and since the 80s would see that houses up here are single family zoning and would have quote unquote better schools or nicer housing or bigger lots, backyards, while ones down here are mostly multifamily housing, more commercial areas. Also, there is more industry down there as well. So all these things really uh, reinforces the impact of those redlining decisions made a couple of generations ago. And then I'll talk about more in a minute as well. But then so socioeconomic factors plus the last map here, sense of populations. So this is things like community population when it comes to cardiovascular disease or low birth weight, among other things that are tracked when you go to the hospital and list what zip code you're from. So again, that these two maps together make vulnerability. So we have threat times vulnerability, and that takes us to the next thing, which equals risk. So again, this is from State Department of Health. So I'm just illustrating this example to highlight the impact of health outcomes. So putting this together, we have the health burdens on communities. So again, you can see a much higher ranking, the darker colors, the darker purple down in these neighborhoods compared to the neighborhoods up in the north here. And of course, these on the east of the city, adjacent to the water. And It's also worth noting that the highway I mentioned has some bad scores as well, and that is its own probably 30-minute tangent around how that impacted neighborhoods and community aspects, but we won't get into that right now. But So it's worth noting that climate change wasn't actually a part of these maps. These are physical, measured um, data points that lead to these maps. But climate change does exacerbate all these existing pathways. So extreme heat, as an example, has a much higher impact on populations down in this area. Uh, and I'll show you a picture why. Because of things like heat island effect, because of more density, a lot more pavement, there's no tree canopy compared to single family zoning. So this is an example of South Seattle. So this is Rainier Avenue facing north. Well, it's at an angle, so north is going this way. And then east and west here, this is, I think, south of Othello Street. So this is a major thoroughfare. We have 5 lanes, so 2 lanes in each direction, plus a turn lane. There's also light rail that's on the surface, which was a decision made in the past 20-ish years. Again, the impact of those past 60, 70, 80 year ago decisions that made it much more feasible to do that here than in North Seattle, which I'll talk about in a minute. And then just to orient, so this is right over here. This road over here to the west goes down a steep hill, then leads over to I-5 as well. So that's kind of I mean, not every neighborhood looks like this, but just as a main thoroughfare in South Seattle, where there's a lot worse health outcomes compared to looking at a high thoroughfare look in North Seattle. So this is kind of the central part of North Seattle. This is again, to orient, so north is going this way at an angle. This is Northwest 80th Street. Uh, just leading this way leads to I-5 again. There's a big entrance to I-5. So many cars use this every day. Down to the south here, we have Green Lake, which is a natural lake formed by glaciers, which is a huge city park. And you can notice the difference between the two pictures. Multifamily housing, lots of concrete versus all single family houses, lots of trees, a lot of backyards. There are a couple of small apartments like this one over here, but that makes a huge difference here as far as the health impacts that climate change brings. Because when you're walking out of this building and going to the train to go downtown, you have to stand in a very hot street, and the heat island effect adds 10 to 15 degrees. in that example of extreme heat. So that really can impact your health. You're waiting to cross the street. There's lots of cars versus up here. There's a couple of bus stops on this road and on this road to go downtown if you need to, or most people probably drive in this neighborhood as well. So all these things really exacerbate those existing pathways and kind of reinforce those past issues and leading to those worse health outcomes. Um, a few other notes looking at this map. So this is the Duwamish Riverway, which is actually named after a tribe that was here for time immemorial, but is not recognized by the United States. Again, a long history and tangent worth looking into. But the maps here illustrate the much worse health outcomes in this neighborhood. That's not by coincidence, because a lot of industry developed along the river, which is probably true everywhere uh, as the industrialization happened, as proximity to waterways. But this is actually one of the only Superfund sites in the U.S. That currently still exists for waterway. There's a Boeing plant here, and the city and the county polluted heavily in this river. But the tribe relies on this waterway for their well-being and health. So I guess not to belabor some of the point here, but I guess looking at this map, you could really see the premise behind what zip code someone is from and the impact on their life expectancy. And again, this relates to community health. So individual outcomes can, of course, be wildly different and really buck that trend as outliers. So hearing a story about, and this is what detractors typically say when you look at a community generalized map like this is, I know a story about Aunt Jane or Uncle Joe or whoever who spent every day of their life living like right here in this part of South Seattle and lived to 100. But that is included in the data for community trends, but it doesn't really change the overall premise of what we're talking about. Okay, so hospitals don't only just treat the patients for those ailments that they have, but also invest resources into into improving upstream social determinants of health to better community health and health outcomes that I've kind of highlighted in the last couple of slides. So this all comes through community benefit reporting. So a nonprofit hospital needs to provide a community benefit to maintain its tax exempt status. And this process includes a 3-year community health needs assessment, or CHNA, that identifies those key areas and results in that annual reporting to the community benefit reporting. And that leads to program access to really improve conditions. So here in King County, these dozen or so healthcare systems and a few other health adjacent organizations come together and convene to be able to create this one regional CHNA. And most of the priorities here really are focused around everyday issues like food insecurity or gun control, but it could also really tie into climate becoming more and more of an issue. So here is an excerpt of what climate impacts are in the CHNA. So uh, uh, so some organizations actually go a little further than this because they serve more than just King County. So some of these hospitals are only in King County. But when you look at, I'll use Children's as an example, they serve what's called the WAMI region. Which is the Washington, Alaska, Montana, and Idaho region. So way beyond just the county. So they do their own CHNA that goes a little further than the county one. And that ties a little bit more specifically. They publish a community health implementation strategy plan, which is another 3-year outlook. And here's an excerpt from that, which is available on their website. And that really goes into a little bit more detail specific to note infrastructure related items in energy reduction, anesthesia emissions, as well as a few others that are called out here that they're working on to be able to address some of those social determinants of health upstream. So that's to say, putting this all together, climate action work can explicitly connect with the hospital's community benefit and external reporting requirements, which gives it a little bit more credence to the interventions to do the work itself. So hopefully, all this taken together illuminates that kind of the broad community public health and health outcomes. Uh, it's also very complex. And there's many variables which impact the final outcomes. But it's also not just a black and white issue like that the story of the outlier that lived to 100 years. But all we could do from a public health and community perspective is to universally lift all social determinants of health to raise the floor of the community of community health so that all have equitable access to the opportunity to live a long, healthy, and fulfilling life. So next, that really takes us to climate action and mitigation in healthcare. So knowing why, I think, really helps put more focus on the what to do and working together to basically uplift the community, like I was saying. So why do we care? Oh, sorry. So yeah, climate action, mitigation, and healthcare. Uh, Hospitals are complex environments, and that's kind of illustrated in this picture. This is a picture from the Healthcare Climate Council Playbook on mitigation. So hospitals run 24/7 and use tons of energy. They're open 365 days a year. Ambient space is heavily regulated once you step foot in the hospital in every location across the building. You have inpatient care, like up here, you have ORs, you have urgent care and outpatient. You also have emergency department. Then there's all these areas use tremendous amounts of supplies. So you have receiving for supplies to come in. Not shown here is the waste downstream once you use those items, plus the commuting for both patients and staff to get to the hospital. And there's also food service for people who tend to be in the hospital for a long time. So all this to say, it's very complex, and there's a lot of different areas that we can make an impact on by some deliberate and planned actions. And all these areas can really function as they have, but they also could function more efficiently from a climate perspective because the business as usual um, plan really has gotten us to where we are today. So we could do both big things like moving to all electric, all clean generated electricity to run hospitals, or also small changes like little things like processes for purchasing that really can change the impact that operations of hospitals have. Uh, so brief brainstorming questions. We don't have to necessarily answer them, but just something I'd like everyone to kind of think about. Uh, how would you explain or sorry, if whether you work at a hospital or for a hospital you support or have a project at or whatever that might look like, how would you explain sustainability to senior leadership or to your peers or even to frontline staff? Because that can really help formulate your strategy of what you want to do and how you want to do it. Do you have the data to support the narrative? A narrative is just that. So without the data, you really need that to set the goals and measure the progress. And then what are your goals and how are you going to get there? Because once you have that data and you set those goals, you need that collective and deliberate action to achieve those goals. And then how do you receive senior leadership support or approval for initiatives? Because grassroots efforts really do make a difference and can get you pretty far, but they can only get you so far. And ultimately, you need that senior leader support, especially on those big ticket items, to take you to the next level. And the climate action planning is kind of the way to do this. Um, Hopefully this will work. I wanted to do a brief poll to try to just kind of bridge where everybody is. So there it is. Thanks, Amber. So yeah, quick poll here. Two questions about yourself and about your healthcare facility itself, or like I said, the one that you're supporting if you don't work directly for a healthcare facility. We'll give it a few minutes to, or not minutes, like 30 seconds or so to get people's answers. How's it look, Amber? What's the hit rate so far? All right, 17 people so far answered. So yeah, okay, so just to get an idea, so most people know a fair share but can learn more. One person is an expert, so nice job. Uh, I try to be kind of silly with the answers. I try to recycle, and then Susta what? So roughly everyone's in the middle, and then for the healthcare facilities, most people, most hospitals tend to acknowledge the concept and attempt to make progress. So that's great. That's a great starting point. That's probably the most common answer I would imagine across the country. So that's great to see that. And then one person is also is a leader. Okay, so I just wanted to get that just to get a good understanding of where people are at. Um, so I wanted to start on climate action planning around how do you start something? So first to say that you're not in this alone. There's a lot of material and resources to really help take you where you need to be. So I started here with the Practice Green Health program to really help guide and give context. But it's also not the gospel, so you don't have to use it if it's not helpful. But you can if it is. So they list 11 different programs. Those are the icons directly from their website. Most of these are very relevant to hospitals, energy, water, emissions, transportation, but some may not be as much, especially if you don't have as much OR spaces or maybe limited or no food services, green building if you're not really expanding or doing a lot of work. So, take it as you need it. Uh, Really key point is obtaining data. You need data to create baseline to measure success. And then without that data, there's no way to measure that impact. And you can be surprised what you can get if you ask. But also conversely, you could also be surprised at how hard it is to get specific information that you do want. So you don't know until you actually ask, though. And then benchmarking, so that's something to really help determine goals and progress, unique to your own organization, but as it relates to where you are compared to all these other organizations across the country. And then everyone can do something, which I'll get to in a minute. Okay, I think I need to speed up a little bit. I talk too much. Okay, so I wanted to run through a brief example in energy. So this is a sample page from Practice Green Health benchmarking report, which shows energy data that are submitted by roughly 500 hospitals. This is 2024 um, report. So here it shows the three ones that I want to focus on are EY from Energy Star Portfolio Manager. There's also weather normalized EY, which just takes a normalization factor to the energy usage. The Energy Star score, which is itself a benchmarking tool because 50 is a median. It's something that compares all similar sized buildings across the country that have data in Energy Star Portfolio Manager. So what I did is because I can't talk about anything specifically, I pulled some publicly available data. This is the 2024 data from the city of Seattle for all hospitals within the city limits for something called the Building Tune-Ups Law, which requires annual submittals. So I took away the names of the hospitals. We're not trying to identify anyone, though it is publicly available, so anyone could look it up if you really are interested. Um, but essentially, building tune-up started in 2016 to push low to no cost energy efficiency upgrades, and then they require annual submittal of data for compliance. So this is a great example of legislation with government accountability and public available records to be able to track that. I love seeing that sometimes. This is all sorted by the weather normalized EY here, right in the middle of the screen. And oops, a couple things to note. Um, Washington State has the Clean Buildings Law, which was essentially to lower EUI to a certain level depending on building size and building type. So for hospitals, buildings have to be at 215. And then so these few, couple at the top, three have a little bit of work to do to get to that compliance standpoint, which is due later this year, actually, for the largest buildings. Then looking a little bit lower in this data set, you can see that some of these newer buildings have the year built and the square footage, which so EUI is total energy divided by square footage. Some of these middle ones are doing quite well, and some of the newer buildings are doing really well. And there's a mix of new buildings and old buildings that have really low EUI and also high Energy Star score. So it's easier to do this for a newer building, but of course it's not impossible to retrofit an existing building. It's just a matter of how much it costs and the ROI. So looking at this, these middle ones are right in uh, the top 10. The energy circle is top 10 percentage of benchmarking data. So pretty good spot to be in. And these lower ones are really good and probably can't really use this benchmarking data other than to really feel good about where they are. So that's just a way to cross-reference that, I guess, as it relates to your journey versus other people's journey for a healthcare system. So what these down here could probably do is more focus on that renewable energy outlook and being more resilient into their operations. And then also what's not on the screen is I pulled utility costs myself when I was doing this work to really connect the dots there because utility costs only go up. So really connecting energy efficiency to cost reduction is a great way to move things forward wherever you are in this journey, especially early on when there's a lot more bang for your buck as far as low-hanging fruit and the impact that has to cost and energy efficiency. So then what's next with that? So really, there is no secret sauce. It all comes to collaboration. There's no shortcuts. You really have to roll up your sleeves and have those conversations and meetings with subject matter experts. I like to say, take a book out of page out of Hamilton. Gotta be in the room where it happens. The room where it happens. I don't want to sing that, but really, that's where you need to be to understand what's possible and also understand the limitations. Because you could find that historical data, like that was a snapshot of 2024 data, but looking through the historical data, you could really see progress, and you could also see trends and understand the narratives that explain maybe the highs and lows that you see in that data. And you also working with closely with those subject matter experts really gives you uh, better understanding of operations. I'm an engineer, so that helped with the facilities teams as far as those details. But not every sustainability person is. So really understanding where they're at and what they're doing and what can be done. Are there limits or barriers? Other resource limitations, probably for all hospitals. And again, this is very data driven. So these efforts can lead to those smart goals that kind of touched upon briefly in the previous slide with benchmarking tools. And also really helps build those meaningful relationships to make this happen. And also worth noting climate action planning is a very high level strategically aligned plan. It's not a full decarbonization plan or any that level of detail that tells you every last little thing you have to do to get to where you need to be. The point of working with the teams and leaders is to identify those goals and document the plans for long-term success. Even as people change or the hospital, or even as people change, so that the hospital stays on the path to being more sustainable. So going back to those, the previous slide on the benchmarking tools and the data from those the hospitals within the city, what are some of the goals that could happen here? So we have EUI goals. So 215 is to be compliant with state laws. So that's the bare minimum, and that's governed by legislation. So that's an easy one. But the stretch goal could be get down to 185, which is about 15% better than where the other one was. And I have to say, this is really difficult to say to do without any specifics, but just trying to go like a high level version of this. Um, Another one could be Energy Star goal of 75. I'll say this around recognition. So Energy Star 75 gives you recognition from Energy Star to have this plaque on your building. Uh, when it comes to recognition, though, in my opinion, it's worth following up if you're doing all the things anyway, or most of the things anyway. Like if you had an Energy Star goal or score of 70, then maybe you could do a little bit more to put in that goal to 75 because the recognition could really help garner that extra support, maybe that extra push to get to that finish line, and also really reinforces all the work that you and your health system have done to get to that point. But the other side of it is if you are at a score of like 25, then it's probably not worth putting that as a goal. So just really depends on where you are, unless your senior leadership or others really like that external carrot, and then you can make that happen. But it's usually not a driver as far as decision making overall. And then renewable energy, again, looking at those really well-performing facilities, that benchmarking data didn't really have where the energy is coming from, but uh, since they're already doing so well energy efficiency wise, it's really looked to become more resilient and focus on getting all your renewable energy. Renewable energy is really kind of a hit or miss thing. You have sometimes the project could take you close to 100% right off the bat. So maybe having a smaller goal to show that it's doable, but logistically it might just be all or nothing. So that might depend on a lot of the variables specific to that health system. And of course, cost. Uh, like I said, everything comes back to cost and reducing costs. So I looked at dollars per square foot when it comes to all the different energy sources used, and that really makes a difference in making this happen. The other part of it is action. So it's one thing to come up with goals, but then looking at specific actions to actually get to where you need to be. Uh, so Actually, level two audit is a great way to identify those big picture and low-hanging fruit ways of achieving EY and energy efficiency. There's a lot of infrastructure projects I'm sure your facilities team already knows about, and that's where having those conversations and doing the hard work that takes time could lead to figure out what those are and then figure out the evaluation of what energy efficiency looks like and putting values to that and then renewable energy itself as well. So after you do all that, those long discussions really look at hard look at operations, and after you reach those consensus on whatever those goals are and the actions to get to them, to actually document it. And that's something that I find that a lot of people don't do in any notable way. Maybe there's a Word document or something floating around, but once it's documented, it might just sit somewhere on in the cloud and no one looks at it again. So a couple of points here. First, it's an iterative process that takes a bit of effort with the stakeholders. When I was doing this at Children's, I realized that no one was really going to do it, even the subject matter experts. So I ultimately just took it on myself and just wrote all this detail. Um, it took me a number of months to do that, and a lot of it ended up happening off hours, which was unfortunate, but that's kind of the nature of the work because the day-to-day work is doing the work, and then documenting it was a little bit more effort um, to showcase some of the things that were happening. Also, it made sense to me personally as the implementer of the plan to do it myself rather than having someone help me in that sense, meaning that there's plenty of third parties that could support you doing this if that's the way you want to go. But I chose not to when I was doing this at Children's. And then the other thing with this is once you document everything, make sure you use any internal branding because a Word document it has information, but senior leadership or other high level people won't really look at it or care about it at the same level unless it looks nice, which might sound silly to say, especially for us engineers, but that is true. That is why branding exists. So take the time to do that. I worked up with our comms team to make that happen because I cannot do that myself very well, but use your resources to do what matters to make that last point. And like I said, I can't share what I did at Children's because I'm no longer with that organization. So I just pulled two examples that are available publicly. One is for King County, which is just updated this year climate action plan, and then this one is from the city of Seattle. It's weird. It was written 12 years ago, but they've been putting in updates in this document. So that's why it's 2013 to 2025 progress report. So yeah, take a look at what other resources you have available locally as well, because it's not just creating a plan out of the blue. There are organizations that do this. So what does the plan look like in detail? So it kind of follows this presentation, a little bit of why, which I how I started the presentation, set the intention of the goals, which are resilience, cost reduction, patient outcomes, the background, then do whatever program works for you. I focus on energy, but there's a lot more that you could talk about and go into a lot of depth. When I was doing this at Children's, there's a lot of work happening at all these different program areas. So I really wanted to consolidate it all into like a high level overarching document that the sustainability team owned and could really help reinforce and get those bigger picture approvals with senior leadership as well. And then once there's a plan in place, you got to make progress. So work on what you identified to do and do those things. Because really the point of this is to really educate and empower all staff so they can all be part of the solution. And it's not part of their own silo, but just integrated into organizational efforts. So that really furthers engagement and helps with that fiscal year planning for each department to do a little bit more. So like for the energy goals, 26 could be really focused on EY, and then 27 could be maybe that Energy Star certification, and then 27 through 2030 could be that renewable energy goal to really take it to that finish line to where you want to be as you outlined. I know I'm running a little long, so I'll go through these last few pretty quickly. So tips for success leading sustainability. Resiliency. I think this is the most important point in healthcare. Everything could be viewed with focus on resilience, lowers costs and improves operations. Lowers costs because it takes away from utilities. Utility costs only go up. Improving operations by planning and streamlining the response. So anything out of the ordinary, regardless of the circumstance of what caused it. I did recently see a story, maybe about a month ago, that there was a power outage in the SF area, San Francisco area, and there was a new hospital there, the UCSF Parnassus, that kept its light on because it had a microgrid and it had that power generation capabilities that the rest of the city did not have. So that's really important for for a hospital to be open and available for that community needs and being a resource in those crises. Um, Another point is reliability-centered operations. This is more of an FM-led thing, but it does lead to a lot more energy efficiency using data analytics in equipment to really be proactive about maintenance. Uh, and then really the most important piece beyond resilience is building relationships because this is true for anything you do anywhere, is really build that relationships, really get to know people and they'll be there for you and you be there for them. And that really gets you to where you need to be. All the grassroots efforts on sustainability or anything really to really make things happen. Because those top-down edicts don't really always happen, especially in sustainability. So educating others, showing those mutual benefits for sustainability, working with those other departments really gets to a partnership to work together and get to where you need to be. One thing that specifically worked for me was physically showing up. We had quarterly meetings for community health and some other teams, and I was one of the only people who showed up regularly because it wasn't hard to plan around those once in a quarter meetings. But that really built a lot of that rapport with that team, and that led to other conversations that led to other tasks, including some external committee work and other things that really pushed this work forward as well. And then community resilience. One thing I want to say, uh, one piece of making operations more resilient is by investing, like everything I said. But the other part of it is working with regional partners and the hospital community and emergency management teams. There's a lot you could do, and building a climate resilience plan is a big piece of that. And this connects back with the CHNA and then emergency preparedness, both regionally and for your hospital itself. And then that could lead to other conversations and really have that really well-functioning community team to respond to a crisis. And that brings me to another point, which is partnerships with those different organizations. So climate action is not exclusive. Sustainability is not its own thing. There's other groups and efforts that are really pushing this effort. So these are some of the other organizations that are doing it. Um, I'll just focus a little bit on the Anchor Network. There's three pillars to Anchor Network work. Anchor Network is basically saying that hospitals and colleges and other big institutions can't really move. They're anchored in place. So it really focuses on that upstream social determinants of health of hiring people, purchasing locally, and really investing locally, because that's the main socioeconomics are a main factor in health outcomes. And sustainability supports all of that. So really understanding that and working together with those teams to make that sort of investment to better local health as well. Um, how to take action. So last slide. So there, depending on where you are, of course, there's a lot of things you could do. Learning about the issues, a lot of the background and health outcomes, and taking that as it relates to doing the mitigation work. Um, Anyone could really do anything is really the main takeaway because there's it's tons of data, energy data, supply data, waste data. It's just a matter of finding that data, analyzing it, and working with the teams to figure out what needs to happen and what's actually feasible from where you are. Once you have that initial plan, work into the strategic plan for the overall hospital as it relates to everything else the hospital does, and then continue to build support at all levels, working with all leadership teams. And then once you get really far into this work, is really revisit and re-implement and keep on. It's like a plan, do, check, act QM cycle where you see what works, you see what doesn't work, and you reevaluate and keep the momentum going. Because ultimately sustainability climate work is I think is really fun and it's really for everyone, for scientifically minded people, policy wonks, data nerds, the people who are really out there in community, persuasive types who are big public speakers and everything else, leaders, implementers. Anyone can really do this work, so there's an avenue for everyone to do something, and only by doing something together can we really address the pollution caused by operations across the board and improve community health for all people to live a long, healthy, and fulfilling life. Yeah, so thank you. Sorry, past Christina.
Oh, that was great, Srini. Thank you so much for that thorough overview of what we do when we're working on sustainability in healthcare. I heard lots of places where my team has experienced and has helped our clients do this kind of work, and um, it's really rewarding when you're able to make change because it does impact people's lives and health. So thank you for that. We don't have time for questions and answers today, but I would like to let you know about next month's event. We are going to talk about kitchens specifically. I'm particularly excited about this one because kitchens are sort of the last frontier for decarbonization for a lot of us, where you're trying to address the energy consumption or the carbon emissions associated with all of the energy that gets consumed in a kitchen through natural gas, steam, electricity. And we are really excited to have Chef Christopher Galazza come and talk to us specifically about the economics of electrified kitchens. So you get to hear a little bit about how this really works in the real world. And he's a really engaging speaker, and I know you'll all enjoy it. So help spread the word to your food service folks at your facilities or at your clients' facilities so that they can join us next month. All right. With that, we will wrap it up. Thank you so much. And we're off to a great start for 2026. Have a wonderful day, everybody.